Welcome to the tutorial on understanding the healthcare system, finding statistics, journal articles, and grade literature using library resources. To begin, open any internet browser. Go to the library's website, which is medlib.bu.edu. When you begin researching a topic, it's good to check to see if we have a subject guide for it. A subject guide is a collection of trustworthy resources about or useful for a particular topic. Hover over subjects A to Z, select Subject Guides. Select D through H, and down under H you can see the healthcare system. You can see that we point out some useful search terms for looking for print resources, any books on reserve relevant to this topic, ebooks, databases, e-journals, and recommended websites. To browse an ebook, simply look for a title that seems useful to you. For instance, this one about approaching to measuring the sources and costs of health and healthcare. Click on it again, and now you're at the book. Most ebooks will let you browse by clicking on their table of contents that are hyperlinked. If you click on one, it will jump to the section of the book that is useful for you. It's a nice, easy way to get familiar with the topic. An e-journal that is particularly useful for this topic is Health Affairs. It's mentioned in quite a few places. You might want to check that out. And all these recommended websites, as I mentioned before, are trustworthy and vetted for by the librarians. One that is particularly interesting for gathering statistics is this Medical Expenditure Panel survey. If you click on it, it'll bring you out to the website. And you can see that this was a set of surveys done across medical providers, families, individuals, and employers across the United States. And this is a great place to get statistics and data for your research on the healthcare system. One good one you can look at, if you click on the uninsured, and then click on health insurance tables. I'm going to go ahead and narrow this to 1 year. Let's go with 2010. And I'll select expenditures per person by healthcare service. Then if you hit search, you can see it pulls up a bunch of possible tables for you to look at. I'm just going to go ahead and look at the first one. And you can see that this averages expenses per person with expense and distribution of expenses by source of payment. So you can see how much of the expense was paid out of pocket versus private insurance, Medicare, Medicaid, or other. And it also is broken down by various demographic statistics such as age, sex, and race, ethnicity. And of course, health insurance status. It's a very interesting, useful table, and there are many of them on this website that could be useful for you in gathering statistics. But now let's go back to the subject guide, and let's say that you have gotten your background information on the healthcare system, and now you understand that the American healthcare system is complex and is provided by a mix of the private and public sector due to a combination of private insurance and government assistance. You've noticed that it started undergoing governmental reform in 2010 with the Patient Protection and Affordable Care Act, commonly called Obamacare. You've thus come to understand that the American healthcare system is an interdisciplinary research topic covering medicine, business, law, and public policy. And you are particularly interested in the economics of healthcare reform. So now that you've gotten your background information and some statistics from your ebooks, e-journals, and websites, it's time to start doing more in-depth research with databases. A good database to begin with is PubMed. Go ahead and click on it. Now PubMed is a free database, but it will ask you to log in. Logging in by going through the library's website lets PubMed know that you're affiliated with us. And if we own the article whose abstract you are looking at, it will let you know that so you can view the full text. Now this is a free biomedical database created and run by the U.S. National Library of Medicine and the National Institutes of Health. I'm going to go ahead and start with this search bar right at the top and do a Google-style search and put in healthcare reform economics. Now you can see that this search brings back almost 18,000 results, but there's this suggested search right here. Now this is interesting. My natural language search was close enough to the mesh terms that PubMed was able to recognize this. So I'm going to go ahead and click on this and show you. Now, what's a MESH term? MESH is a term for medical subject headings. Basically, the people at PubMed take every article that's put into the database and from a list of pre-agreed upon terms called MESH terms, tag that article as being about certain things. This helps you create a more refined search strategy. Now, so it was able to recognize from my natural language search that I wanted the MESH term healthcare reform, and that I also wanted the subheading of economics. This is a little hard to understand without seeing it in MESH, so I'm just going to go ahead and take you over there right now. From this drop-down menu, select MESH. This is basically going over to search in a thesaurus to find the terms you need. I'm going to go ahead and put in healthcare reform. Here's a list of possible results. Underneath each term is what's called a scope note, which is basically a definition of the term. I'm going to go ahead and click on healthcare reform, and this shows you the full entry. Now this here is what I was talking about when I said subheading. If I check off the box next to any one of these items, economics, methods, standards, I will search only for things particularly about the economics of healthcare reform or about the standards of healthcare reform. So instead of getting everything about healthcare reform, you get a tiny narrow area. And it's very interesting to me that PubMed was able to figure that out just from my natural language search, that was the MESH search that I wanted to run. That was much narrower than our broad natural language search. So I'm going to go ahead and do what PubMed did and turn on economics. And if you scroll down a little, you can see all the terms that reroute to here. So if I'd put in healthcare reforms, it would have brought me here. You can see terms that were previously used for and the years they were used. And you can also see where they fall in the tree. So say I'm getting too few results, I could step back up to a broader term, which is health policy, and an even broader term, which is public policy. If there was a narrower term, it would show up underneath healthcare reform. Now, in order to get back to PubMed, I want to go ahead and click Add to Search Builder. And then I would click Search for PubMed. But first I want to add one more term that wasn't put in naturally by PubMed, which is that obviously healthcare reform can happen in any country in the world, but we're particularly interested in the United States. So I'm going to go ahead and put in United States. Regions are terms in MESH. Now I know that I want the United States, so instead of bothering clicking out to it, I'm going to click the checkbox, make sure this is saying an and, so I get this and the United States. Hit Add Search Builder. Now I have my search, healthcare reform, economics, and United States. So now I want to send that back over to PubMed. I'm going to hit Search PubMed. And now you can see that we have about 3,000 results. Now, understanding the economics of healthcare reform, that's still kind of a broad topic. There are many more narrow items you might want to talk about within that. So using this search, we can then start looking at narrower topics within it. One thing that comes up a lot in healthcare reform talk is comparative effectiveness. And that's saying, can we use this different drug, for instance, from this other one and get the same results when one is cheaper? So if I put in comparative effectiveness in MESH, you can see this is the term for it. And I'm going to go ahead and hit Add to Search Builder and search PubMed. I don't have to completely rebuild my previous search. All I have to do is go up here under the search bar to Advanced. PubMed keeps track of everything I've done for the last 8 hours, and you can combine previous searches together. So here's my previous research that gets us healthcare reform economics in the United States. So I'm going to hit Add. And then I also want comparative effectiveness research within that. So I'm going to hit Add again. And then I'm going to hit Search. Now you can see that gets us down to only 15 results. For a topic as broad and interdisciplinary as the economics of healthcare reform, understanding that in the United States, you might also want to look at various other terms such as health insurance. You can see here's insurance health, and I know since I looked before that that's the term I want. So I'm just going to go ahead and check the checkbox again, hit Add to Search Builder, search PubMed, do just like we did before and go to Advanced Search and combine that with our healthcare reform economics search, and then hit Search. So there you can see that this topic, health insurance and healthcare reform, is actually a broader topic than the other two that we had tried. Another thing you can do to narrow your results is to use filters. Go back to advanced search. We want to show our original search. In order to do that, I just hit the number next to it and then hit show search results. Filters are here on the left-hand side. They don't all automatically show up. Click show additional filters and check off the boxes next to them and then hit show to make them show up. Some that might be useful for you within this topic are, for instance, under subjects, more, history of medicine, show. You might be interested in how healthcare has changed throughout time, or you might be interested in how historical case studies might impact what you are looking at for understanding the healthcare system. In order to turn that on, you just click on it. And you can see that gets you down to a nice number of results. And I hit clear all to show you another. Another good one is under article types, systematic reviews. A systematic review is an article that goes back and looks at all the previously written articles about a topic, so it's a good way to become familiar with a topic. And you can see turning that on brings us back only a few articles. And finally, one other thing you could do is to narrow to publication date. Maybe you're only interested in what's been going on in the last 10 years. So turning that on further narrows your results that way. One final thing you can do in your research is if you find a good article that you really like, click out to the abstract of it. And here you can view what mesh terms it has been tagged with to help you think maybe of more that might be useful for your research. The ones with asterisks next to them are the ones that are considered the most important for this article. So, for instance, cost control. Another thing you can do is look at these related citations in PubMed. PubMed runs a behind-the-scenes algorithm to figure out some articles that it thinks might be related. It usually brings back around 100, and you can browse those. So that's PubMed. Now we're going to go back to the subject guide to look at the next database. Again, the subject guides are under subjects, A to Z, subject guides, D through H, and then H for healthcare system. And the next database that we're going to look at is ABI Inform Global. This is a database that looks at company and business trends around the world. Since healthcare in the U.S. is a business and we're looking at the economics of it, this is a good database to look at. You always want to go to the advanced search. Now, most databases like PubMed have something similar to MESH, a thesaurus of terms that they prefer to use. Here in ABI Inform, it's not called MESH, it's called a thesaurus. So I'm going to go ahead and click on that. And I already know that healthcare reform worked in PubMed, so I'm going to put that in here. And remember, I'm just searching the thesaurus. And here's the term, but I'm going to click on it. You can see that it wants us to use healthcare policy for healthcare reform. Terms that are accepted in the ABI Inform have this little yellow square next to it. Unlike PubMed, I have to send the terms over to my search strategy one by one. So I'm going to go ahead and click the checkbox. Say I want to combine using and hit add to search. Next we want our second term, which is economics. Here's economics. You can see the yellow box next to it, which means it's an accepted term. I'm going to click the checkbox, say to combine it using and, add to search. Now I know from looking at this database before that it's difficult to do regions using this thesaurus. You want to do that later. So right now I'm just going to stick with this healthcare policy economics and hit search. You can see that in this database the results are here on the left hand side and the filters are on the right hand side. You can see we get just over 1,400 results. You can sort your results. You can see how many have the full text available through BU, which you can see is most of them in this case. You can see the source type, which one of the nice things about ABI Inform is that it brings up gray literature like dissertations and theses, and it also brings up things like trade journals and magazines, things that aren't scholarly articles but are still useful for your research. So how am I going to get this down to the United States? I need to use the location filter. I'm going to click on it to open it up. Unfortunately, you can see that there's not one universal location filter for the United States. We have the US, United States, US, United States. Click on More Options to be able to select more than one filter item to include. So you want to include the US, the United States, US, United States. Unfortunately, some of the articles are tagged with the state they're in and not with the United States in general. So you'll have to go down through and tag all the United States. It's a little annoying, but it's the best way you can get it narrowed down to your region. I'm not going to do it right now because it will take time, but that's what you would need to do. And then you hit apply. And that brings us back this many results. You'd have a few more if you tagged all of the United States, individual states that are available. But I just went with the broad ones. So that's one way you can narrow down your results. Another way you can do that is with the publication date. You can see that our earliest article is from 1990, which is a bit early for us. We said before we wanted the 2000s. So we're going to go with 10 years ago, with 2003. So slide your little bar over to the year you want, which is 2003 in this case, and then click Update. And you can see now we're down to 360 results. And if you scroll down again to this bar, this is just interesting. You can see that it shows how many records were entered in each year, so you can see the trends of popularity. And just like in PubMed, when you find an article that you think looks really good, if you click on it, you can go out to the full entry in the database. If the full text is available, the link will be here. You can see similar documents, which is like the related citations feature in PubMed. And you can also see what indexing terms were used for it. So that's ABI Inform, which looks at the economics and business end of the healthcare system. Now we want to do one last database, which actually searches a very particular gray literature area. It searches research projects in progress. So this could be a very good way to see what the future trends might be and to see what the current interests are in your topic area. So I'm just going back to the Healthcare System Subject Guide, and you can see that the Health Services Research Projects in Progress is the next database that we're going to look at, and it is right there. Go ahead and click on it. Now this database provides information about research in progress before results are available in a published format. So it's a gray literature database, so it's different from the other two that we've looked at. You can notice that it already gives you a couple of tips for searching. One is that you should enter multi-word terms into quotes. That's something we're going to use in our search. You can also see that you can search based on the investigator who is doing the project, or you can search based on the supporting agency. It's actually really interesting to browse the supporting agencies. You can see right away how many projects they have in this database. So for instance, AHRQ has a lot and Alzheimer's only has one. But let's go to the advanced search. There aren't a ton of advanced search options. You can narrow by year range, which honestly isn't that necessary since this is for research projects in progress. That's already kind of narrowing to fairly recent. You can also look at ongoing, completed, or archived, or at the region. But I'm just going to go ahead and start really simple and put in healthcare reform in quotes and economics and search. You can see that brings us back 159 results. And when you click out to a project that looks particularly interesting to you, you can see again this is different. It's not particularly that you get the full text of the project since nothing is written up yet, but you can see the performing organization, their performing URL. There's a phone number, there's their supporting agency, and it tells you their funding, and you can also have the primary investigator's email address so you can contact them for more information if you want. And there's of course the abstract, and there are also MeSH terms. So this is one way you can see that learning the MeSH terms early on in PubMed helped you with doing this search since you knew what term to put in for this database. That can be why it's useful to take the time to look at the MeSH or the thesaurus to figure out what terms might be used by the databases before you start searching. So this is the final database that we're showing in this tutorial. Remember when researching understanding the healthcare system that the healthcare in the United States is complex and interdisciplinary. You will be looking at both medical, business, and public policy and possibly legal resources in order to entirely cover your topic. Thank you for watching the tutorial on finding journal articles, statistics, and grade literature for understanding the healthcare system. For more information about any of these resources or library services, please feel free to contact the reference desk at 617-638-4228 or refquest@bu.edu.